Diagnosis according to Zhang Fu organ patterns. Food stagnation. Food stagnation is often an overlooked aspect of a diagnostic picture, particularly in chronic and complex cases where there are many patterns intertwined with each other. Food stagnation, like phlegm and shoe stagnation, is often a cause and consequence of many chronic patterns of imbalance. This is because many patterns of imbalance can directly or indirectly disrupt the stomach and spleen chi mechanism. Chronic food stagnation will also, in the long term, directly and indirectly lead to imbalances in many other places in the body. The foundation of food stagnation is often laid as early as the first year of a person's life. This will be the case if there was an improper diet and if the baby was repeatedly fed before the stomach had been emptied of food. There will often be vague and subtle signs of food stagnation rather than outright symptoms. Typically, the patient will have a slight sensation of fullness in the belly or bloating for some time after they have eaten, will burp or belch, and will have discomfort in the epigastric region. There can often be a vicious circle where food stagnation causes the creation of stomach heat, which results in annoying hunger. The person then eats constantly and the stomach never completely empties, so even more stagnation of food in the stomach will arise. The etiology of food stagnation arises directly from eating too much at a time, eating too fast, not chewing the food properly, eating too late at night, constant snacking, eating whilst stressed or whilst working, eating while sitting in a twisted position, and eating food that is difficult to transform. If the spleen and stomach are also chishu, food will not be transformed. If there is damp and phlegm, this will weaken the spleen and block the stomach and spleen chi mechanism so that the food stagnates. Liver chi stagnation can also disrupt the stomach and spleen chi mechanism with food stagnation as a result. Yang shu can mean that there is not enough physiological heat to transform the food. Yin shu and heat can lead to transformation of phlegm that will then block the stomach and spleen's chi mechanism. The symptoms and signs are lack of appetite, a full sensation in the epigastric region, epigastric discomfort, bad breath, belching that often tastes or smells of the food that has been eaten earlier, acid reflux, vomiting, abdominal bloating, discomfort when palpating on the upper abdomen, bloating and abdominal discomfort that is relieved by vomit, insomnia or dream-disturbed sleep, feeling hot at night, loose stools or constipation, the stools smell rotten or of sewage, odorous flatulence, thick and greasy tongue coating, slippery or wiry pulse, especially in the right one position. The key symptoms are full sensation or discomfort in the epigastric region, belching that tastes of previously ingested food, thick, greasy tongue coating. The treatment principle would be dissolve food stagnation and regulate stomach chi. And our acupuncture points to choose from: stomach 19, stomach 21, stomach 34, stomach 36, stomach 44, spleen 4, Ren 12, Ren 13, and pericardium 6. You should have a draining needling technique. The explanation, more so, is stomach 19, stomach 21, stomach 34, stomach 36, spleen 4, Ren 12, and Ren 13 to regulate stomach chi and dissolve food stagnation. Stomach 44 dissolves food stagnation, regulates the stomach chi, and drains heat, while pericardium 6 regulates chi in the middle jiao. And for some more relevant advice, it is crucial that a person with food stagnation regulates the way they eat and what they eat. They should not eat too quickly or too much at a time. They should sit upright when eating and chew their food well. They should eat food that is easy to transform, and they should not eat too late in the evening. Stroking downwards with the fingers from Ren 16 to Ren 8 will help stomach chi and the ingested food to descend. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial. Food stagnation can be caused by the following patterns of imbalance: spleen qi shu, stomach qi shu, spleen yang shu, stomach yin shu, stomach qi stagnation, damp, phlegm, liver qi stagnation. The food stagnation can result in the following patterns of imbalance: spleen qi shu, stomach qi shu, stomach fire, stomach yin shu, damp phlegm, phlegm fire, stomach qi stagnation, and liver qi stagnation. Food stagnation in the stomach. Etiology is overeating, eating too quickly, eating while worrying. Underlying and accompanying pathology: obstruction of food in the stomach, preventing stomach chi from descending, stomach deficient and cold, phlegm, heat, fire in the stomach. Their signs and symptoms: epigastric pain, fullness and distension, discomfort alleviated by vomiting or passing stool, nausea and vomiting fluids, halitosis, sour regurgitation, belching, insomnia, diarrhea or constipation, and poor appetite. Poor appetite. The pulse will be full and slippery. The tongue shall be thick with thick coating, which is either white or yellow. The treatment principle is to harmonize and stimulate descending of stomach chi and moves food stagnation. So acupuncture treatment: Ren 13, stomach 21, stomach 45, pericardium 6, Ren 12, Ren 10, stomach 44, spleen 4, stomach 19, and kidney 21. Thank you for your attention.